Are you feeling like a hypocrite telling your kids don't do drugs? Well, don't. It's a different world, and these are different drugs, and we live in a world now where one pill can kill. I'm Jodie Sweetin, and today on Awkward Conversations, we explore the difference between drugs of today and drugs of the past. Joining me today, as usual, is Amy McCarthy from Boston Children's Hospital. Hi, Amy.
Hi, Jodie. We have a great lineup of guests today. First off, let's welcome back to the show Special Agent Wendy Woolcock, who serves as the DEA's Deputy of Chief Operations. Wendy is also a mom of two. Welcome, Wendy.
Hey, Jodie. Hey, Amy. Nice to see you all again.
We're also very pleased to have on the show today Chief Dean Esserman, a graduate of NYU Law, former police chief of Providence, New Haven, Stanford, and the New York State MTA Metro North, and one of the fathers of community policing.
Which is incredibly impressive, but the other reason that we're really excited to have Chief Esserman on the show is he is a parent, but not just any parent. He happens to be the father of our very own producer, Nellie June, and we plan on getting some really embarrassing dad stories about Nellie after the show and hearing about all of the stupid things she did as a kid. But in the meantime, Nellie, would you like to say hi to your dad?
Hey, Dad. Welcome to the show. Happy to have you here.
So, you know, the theme of today's show and what we're talking about is the drugs of today versus drugs of the past. And, you know, I'm 41 years old. I know that in the 20 plus years it has been since I was an adolescent and a teen and a young adult, drugs and the whole entire production and everything it's so different now than what it was. And you know, there are a lot of people out there who, you know, did stupid stuff as a kid and as a teenager, but it's so different today. So can you talk a little bit about how the drugs of today have really changed compared to what they used to be?
Yeah, sure. Great question. And I think it's an important one that us in the law enforcement community, the healthcare community, and as parents all need to be well aware of. And I think the biggest thing that we need to stress is the drugs of today are more potent. They are more available. They are synthetics, and they're cheap. And because they are so readily available, they're easy to use, they're easy to get. Rather it's over an e-commerce platform, easy to pay for. It makes it very dangerous for our children to get and to use, and the potential for a lethal dose and a synthetic opioid such as fentanyl is extremely high and extremely dangerous. So I think that's the biggest challenge and one of the biggest threats that we all face right now.
I would agree. When I started before I was a police chief, I was a prosecutor in New York City, and I was in the 80s during the crack wars, and I saw a new wave of drugs come in after cocaine and heroin, crack, and that devastated the community. And that's nothing compared to today. Today is even more dangerous and more powerful and more available and cheaper. And I've witnessed too many deaths in my years as police chief.
Something that keeps me up at night is knowing that between 2019 and 2021, fatal overdoses related to opioids increased for 10-year-olds to 19-year-olds by 192%. It's almost unfathomable to think about how impactful that is and how scary that is for kids today and for families.
Yeah, and you know, we were even having a conversation today. There was a story in the news that I saw about, you know, even pharmaceuticals available at pharmacies in other countries are now being found to have fentanyl in them and to have, you know, be cut with other substances. So, you know, now more than ever, particularly with street purchase drugs, you don't truly know what you're getting, and you don't know what that pill is really made of. And I have, you know, I know several friends who have lost children to, you know, one time, or you know, it wasn't something they did all the time, and that's it. And you know, the potency and the overdose possibilities are just so much greater now. Now, what should parents maybe know about like the increasing potency of certain drugs? I know, you know, cannabis is becoming more readily available, but I know it has increased greatly in potency in the way it's produced.
As it relates to fentanyl, and I'll talk specifically about fentanyl and defer to maybe a chemist on the potency of marijuana, but I will talk a little bit to the dangers and the possibility of drugs being intertwined and commingled and the threat that exists there. But even within the fentanyl world, over the last couple years, the pills have become more and more dangerous. Several years ago, it was 4 out of 10 pills were considered to have a lethal dose, and we are now looking at 6 out of 10 pills. And I'm sure the chief experienced that also, which is why we have the rise in overdose deaths. And just to comment on that too, is there's not a stigma, right? It's a little pill. It's a teeny tiny pill that is very easy to take and very easy to transport and very easy to sell. You're not sticking a needle in your arm. You're not snorting, cocaine up your nose. You're not, on the street corner buying this. You're sitting in the comfort of your home on a smartphone, ordering, paying, and having it delivered right to your house. So I think, your question about marijuana and vaping and commingling fentanyl and with other drugs is a sincere and great question. I mean, I would put anything in my mouth that I didn't know exactly what it contained, because it could be marijuana laced with fentanyl. It could be a vaping cartridge laced with fentanyl. If you don't get it from your doctor or a pharmacist, you should not be ingesting, inhaling, smoking, snorting, any of those items.
And most of those kids didn't plan to die that night. They planned to have some fun, get high. And the parents buried them. More potent than you think. They're 50 to 100 times more potent than morphine or heroin. And they kill.
Yeah, as a parent to 15 and almost 13-year-old girls, it is really terrifying, and it's a conversation that I've had with them many times. We've had reports here of high school students overdosing and dying in their bathrooms at school from taking a pill, and it happens, and it's real, and it's terrifying, and combating that. Adolescent idea of superhuman strength and nothing can get you, and that you're invincible. It's really hard to have these conversations and tell them that these are the realities of it, without sounding extreme or what. It's always been sort of parents just don't get it, and we absolutely do. And today it's scarier more than ever. I mean, how can parents educate their children about those increased dangers of today's drugs compared to drugs of the past?
So one of the things, and I actually have 3 kids at very different age groups, elementary, middle, and high school. And so let me start by saying I don't think there's any wrong way. The only wrong way is not to have a conversation. And I do think it's important, and I know we've talked about this in the past, it's a very serious topic. It doesn't always have to be in a serious setting or a serious conversation, right? So I think you give clear facts, you be informative, you squeeze it in whenever you can. You recognize that you may not be the right voice or the only voice, and you rely on maybe a mentor, a coach, a spiritual leader, a grandparent, a sibling. As long as the message gets across in a manner in which they can understand it, I think it's good. And then I end every conversation with, and by the way, if you do make a mistake, we're here to help, right? And the worst thing you can do is not come seek our help. Every single one of us, and if you don't have it, you should try to carry some sort of opioid reversal kit, whatever the brand may be, and let your kids know that should you make a mistake or should someone you care about make a mistake, we're here to help you. And as the chief said, in a matter of seconds, you could be dead. Nobody intends to die by being out partying and taking a pill, but we're here to help and we can help. So I think just those candid conversations in the very 10 seconds that you have in the car ride, at the dinner table, right before they go to bed, whatever it may be, is extremely helpful.
Right. We've talked about, I was going to say, talking about having those brief conversations that, sometimes parents think it has to be, there was another guest on who has talked about this before, think it has to be one 60-minute conversation when really it's better to have 61-minute conversations and keep it consistent. Just the consistency of messaging, and no kid wants to have an hour conversation with their parents. Most adolescents are like, it's painful.
I can
So
validate that. I can validate that. I've had a situation like this with my daughter.
yeah. Oh, yeah. Nellie is agreeing. She is definitely saying yes. Are there any misconceptions about some of these new drugs that parents and young people typically have that you found in working with parents?
So I think one of the misconceptions is, A, it's not going to happen to my kid, right? And like how we started this program with, the fentanyl pills are everywhere, right? And because it's a pill, because it's tiny, a lot of times there's not the negative stigma, and they're prevalent. And I think the possibility exists where parents would think, well, my kid would never do that. Why would they pop a pill in their mouth? Well, I mean, I have that conversation with my kids all the time, right? So I think the biggest thing is, just because it's small doesn't mean it's not deadly. And the coin phrase that one pill can kill is absolutely true. As much as it is, you could split a pill and you get the half that kills a person, and the other half, the person taking it is fine. So I just think, you just need to pay attention and not put anything in your mouth that you don't know what it is.
Yeah, you just brought up a really interesting point and sort of misconception that, even if you take half a pill, it can still be the more potent half of the pill. Can you talk a little bit about some of the manufacturing and what they call hotspots in these pills that, where most of the deadly medication can be centered in one particular part of it, and you don't know if you're getting that part or not?
Yes, absolutely. You have to remember, these pills are manufactured by cartel members in a clandestine setting in the middle of a jungle or a laboratory. They are not manufactured in a clean environment with regulations and pharmacists and doctors and scientists overlooking the process. So what you can get in these clandestine laboratories is a pill being pressed that is not equally pressed and could contain a variety of precursor chemicals that could be deadly or lethal. So a portion of the pill may contain a stronger potency than another portion of the pill. Just like if you were to bake something at your house and maybe you didn't stir it up properly, and the baking soda all stayed in one portion of the cookie, and it tastes terrible,
Right.
but the other half tastes fine.
Sounds like my kitchen, Wendy.
You see how I related to that very quickly, right? But
Right.
it's not consistent, right? It's a synthetic. It's homemade. It's manufactured by jungle operators who are throwing it together just to make some money.
And I will say, too, one of the things I think that goes overlooked a lot, I know, is a lot of the medications and things that are available in places like smoke shops and in places that sell, maybe vapes or accessories, things like that. There are a lot of different, quote unquote pills that are available there that are often all synthetic, all made of various chemicals, and they're constantly shifting and changing the chemical ingredients in order to circumvent, what's now illegal. And oftentimes these things are produced without any real consideration as to what the eventual outcome will be. So I always like to tell people about that too, because, you walk into these stores and you're like, oh, whatever energy thing, or it can be all kinds of synthetic medication that you don't really know. We'll be right back after this message.
Saving lives means staying informed. Knowing the dangers of using fake prescription pills can help those you care about and keep our community safe. As a parent, educator, neighbor, or friend, we all play a role in building safe and healthy futures for ourselves and our loved ones. Do your part to take the first step today. Visit GetSmartAboutDrugs.com to access education, prevention, and treatment resources. Fake prescription pills laced with fentanyl are deadly. Be their protector. Be informed. Visit GetSmartAboutDrugs.com.
Dean, since you are the father of our wonderful Nellie June here, I would love to hear some of the things that you used and incorporated in discussions with your own kids and raising them about how to be, aware and cognizant of these things and how to keep themselves safe.
Well, I'd like to tell you that I had them followed by my undercover cops, but the truth is I gave them my trust. I told them what was going on in the streets. I let them see it. My daughter, Nellie, went to the emergency room and worked as a medic. I didn't shield her from it. And I didn't shy away from conversations when I came back from work We talked about the truth in our home. I also spent the time listening. And some nights I came home and I had a lot to say, but I let them talk first and ask questions. The conversation, you can't have enough of them. And I find the more you share with them, the more they relax and share with you.
Right. I think, so many parents want to, like Wendy had talked about, my kid would never, it's not going to be my kid. And, it's a potential for any kid. And if you don't have those conversations and at least make them aware of those things, then, you're really missing an opportunity to help them, maybe not only help themselves, but maybe help a friend, help someone that they know who is also struggling or who may be making poor decisions like this.
There's no conversation that's a bad conversation when you're talking to your children about drugs.
Yeah, I think everything the chief said is 100% right, and I know we mentioned this about just having those candid conversations, and we shield them from a lot of things. I have various levels of kids, so I talk to them differently, and I try to relate to what they may be doing. And I'll give you an example with my youngest. I was going to miss an opportunity that she had at school because I had a work event. So that was a perfect time at nighttime as I'm, putting her to bed. And I just started tossing pillows at her, and stuffed animals and saying, okay, well, I'm going to miss your event tomorrow because mommy has to go to work. Do you know what mommy does? And she would answer. And then I would say, okay, well, guess what I'm going to talk about? And she's like, drugs, because they hear it all the time. I'm like, yeah, do you know what drug?
Right.
And I would throw another pillow. And each time I would throw a pillow at her just to kind of make it fun, and she would catch her stuffed animal or whatever. But through that activity, which took 2 minutes, we got out that I'm going to work. I'm talking about fentanyl, that it's dangerous, that it's contained within one little pill. I said, what does it look like? She said, candy. I said, bingo. Can it be different colors? She said, yes. And I said, okay. And if somebody tries to give it to you and you don't know what it is, do you put it in your mouth? And she said, no. And I said, and if you do, what do you do? And she said, dial 911 or come get you for help. But again, that's how I related to her, which is not the same way that I would have a conversation with my older children. And in that example, maybe it's a math computation of, how much fentanyl or how much drugs do you take that could be a lethal dose, and do a math type equation. Or as they're walking out the door, just a simple reminder of what it is and what it looks like and what to do if they need help. But absolutely, be forthcoming with them. Trust me, if you're not talking to them, someone else is, or social media is, and anything that they want to know, they're going to learn about in 2 seconds from their device. And so you've got to at least take your 2 seconds to give your point of view and get it across.
Again, relationship. It's so important, talking, having these awkward conversations. It is going to be weird. It's not, your kids are going to roll their eyes and you're going to be like, please listen to me. And sometimes you got to, not hide them from the truth.
Yeah, there's always an opportunity to bounce back. And again, we know that kids do much better when they kind of know about like the good, the bad, and the ugly around them, and the truth.
Right. Now, a question that I would love to ask you, Amy, is how has treatment changed with more of the emphasis on mental health in regards to addiction and substance use?
Yeah, I think we've made a lot of positive strides in this area overall. Moving away from the stigma of substance use has been a huge piece of that. Being able to, look at and talk about how substance use disorders are medical conditions and are, conditions that are worthy and necessary for treatment in different ways. And so that mental health emphasis is huge right now. I think that often substance use and substance misuse is more of a symptom of mental health than it is kind of living in its own bubble. It's all kind of interconnected.
Right.
And I also think that, looking at substance use moving from a punitive kind of approach to kind of not really treating it, right, but addressing it, so to speak. And so moving more into having mental health support, counseling, family therapy, medications, things that can support folks to really, progress into that recovery state. One thing that I think also is really lovely and just so critically important is that there's a recognition now in terms of equity of young people and of humans in general. So what we know is that young people of color tend to still continue to get, maneuvered towards the juvenile justice system in instances of substance use. And so there's an acknowledgement of that now, and there's a movement towards getting everyone equitable access to mental health treatment, and that's such an important thing for us to continue to build on.
As somebody who's been in recovery and who has struggled with substance use, I love seeing the conversations shifting away from, oh, well, you're a terrible person, or you just have no willpower, or you're just, a disappointment, which was so much of the conversation, really into how do we help you? Obviously, this is the portion that we're seeing, but what's at the root of it? And it's key to really getting to those underlying issues. And as we're having this conversation about moving away from the more punitive aspects of dealing with substance use and abuse, Chief Esserman, you are known as the father of community policing. I'd love to hear some more about that and about what you found really works in terms of using community to help prevent some of these issues.
Well, first I'd like to say there were many fathers of community policing. I was not alone, hardly. But I was a narcotics warrior back in the 80s when I was part of the war on drugs. And drug addicts were demonized. They were considered to be criminals, and handcuffs was the only solution. And we've come a long way from that time. I think I speak for most police officers now who think of drug addiction as a disease, as an illness, and not as a crime. And realize that handcuffs isn't the answer. Understanding is first, second, and third chances are. Looking at a public health crisis rather than a criminal crisis. And community policing has adopted that philosophy when it comes to crime, where we're more focused and engaged in life of the community and problem solving than we are in just being law enforcement officers. To see the police as simply law enforcement officers is to miss the point of what police spend the most time doing, which is helping people, not hurting people. And most police officers have run into a person who's been addicted more than once, more than twice, and they come around to believing through their own experience that another arrest isn't going to make a change.
Chief Esserman, I love to hear you talk about that. I had a wonderful opportunity to be a part of what they called a hub community in Chelsea, Massachusetts, where the police force and community providers and everyone kind of created this wraparound approach because police officers were seeing a person, time after time after time. And so instead of, being reactive, moved towards this proactive model of let's go out and offer people support and get them connected to services and get them connected to the things that they need in order to access treatment. And it was a beautiful thing to be a part of as a provider. And I'm really appreciative for opportunities like that. And it sounds like you paved the way for a lot of those types of things.
Well, I wasn't the only one, but I think from my era has gone from being a lone ranger to being a collaborator. The police have learned to collaborate with others and not just to work alone.
That's a great point. This is a problem of public safety and health crisis that we cannot outrun and law enforcement cannot do unilaterally. And it really does, take a village and to conquer this problem and to get people that need help, people that need corrective action, and communities the support that they need, and parents the support that they need to deal with this public health and safety crisis. It's literally flooding our streets. There's no way we are going to arrest our way out of this problem. So I think emphasizing partnerships, rather it be with other law enforcement agencies, with public health officials, and you guys to get out public awareness is a fantastic way to jointly work on this together.
Talking about the ease of accessibility, one thing that has changed obviously so dramatically is the role of the internet in being able to procure, purchase, sell, buy, get anything, any drugs really that you want, and the ease of that access. What do you see? How do you see that playing out most often? What apps are being used? What's sort of the easiest way that these kids are finding this, while being bombarded with all of this social media?
So from our perspective, the biggest threat is just the accessibility. The fact that you can easily search for fentanyl or precursor chemicals or any other type of synthetic drug. Search, pay, and purchase and arrange for delivery within a matter of 30 seconds, just like you would if you were ordering food from down the street, is scary. And that I think is the biggest threat. There's a level of being anonymous. There's a level of comfort that I'm not having to go down a dark alley at 2 a.m. in the morning to purchase these pills. There's a level of comfort in knowing that you can have these communications over encrypted applications. There's a comfort in knowing that you can pay for your pills using cryptocurrency, right? So I think that is a huge trend that we are seeing is different types of cryptocurrency are being used to buy and sell and move fentanyl pills.
And I would add that you don't always get what you pay for. Sometimes you think you're buying one drug and you're buying a heavily laced drug with fentanyl.
I think a lot of parents don't often consider the fact that as easily as your kid can order a pizza, they can also have access to drugs that are delivered to your home. You might think, well, they're not leaving the house. Like they can't, they're not going to run into anything terrible. And now these things are actually coming into our homes and being invited in through these apps and through purchases. And it is a lot scarier for parents, and you definitely have to pay more attention and look out for those signs and have that constant communication and those open lines of dialogue. So that, if you see behaviors like this, you can recognize them and be like, why was there a delivery at 11:30 at night? That was weird. Like, oh, it's just a thing, pizza bag, whatever. You being aware of those sorts of things. So I want to thank you so much for bringing all of those topics up, for really making us aware of how things have changed so drastically, not even just over decades, but over the last few years. Wendy, thank you so much. Dean, we really appreciate you coming and speaking with us. Amy, as always, I really appreciate you. Thank you so much for joining us today for another awkward conversation.
Awkward but worthwhile.
Thanks, guys. It was such a pleasure and honor to be here with all of you. And I second what the chief said. Awkward, but definitely worthwhile.
Well, thank you so much for joining us. Chief, is there anything that you want to tell Nellie while she's here, working very, very hard, trying to produce all of these awkward conversations with us?
I'm proud to see she's trying to save lives like her father did, just in a different way.
Thanks, Dad.
Aww.
So nice.
Saving, look at you. It's cute. Anyway, thank you so much. I really appreciate this conversation today. We are out of time, everyone, but please join us next week for another awkward conversation. One pill can kill. This is not a marketing tagline, it is reality. Parents are facing an epidemic of fentanyl-laced counterfeit pills. 6 of 10 of these pills has a potentially deadly dose.
There are fake Adderalls out there that have methamphetamine in them, or that there's fake oxycodones out there that have fentanyl in them. And I said, you don't see that as a risk, but there's hundreds of thousands of deaths associated to overdoses every year.
Our number one message is to never take a pill that hasn't been prescribed by your licensed provider and dispensed through a trusted pharmacy. That message is universal no matter who you're talking to.
Make sure to check out getsmartabouttdrugs.com. Parents, caregivers, you can find so many resources of great information there about how to talk to your kids and make these conversations a little less awkward. A huge thank you to the Elks DAP, which is the largest all-volunteer nationwide drug awareness program, and also a huge thanks to the DEA for their outreach program and for making this possible.
The views, information, or opinions expressed during the Awkward Conversation series are solely those of the individuals, speakers, commentators, experts, and/or hosts involved, and do not necessarily reflect nor represent those of the production, associates, or broadcaster, or any of its employees. Production is not responsible and does not verify for accuracy any of the information contained in the series available for viewing. The primary purpose of this series is to educate and inform. This series does not constitute medical or other professional advice or services. This series is available for private, non-commercial use only. The production, broadcaster, or its channel cannot be held accountable for all or any views expressed during this program.